Hello everyone, I have a wonderful patient of mine. She is exactly 23 days out today. And so you had what were a set of implants from 2010, silicone, and your right breast implant was indeed very much ruptured. It was all contained. I did a Facebook Live that day, and it was all contained. Now let me ask you this, how was your anesthesia experience?
The anesthesia was great. I like twilight as opposed to general anesthesia just because I do not recover fast from general anesthesia and I have a lot of side effects from general anesthesia.
Right, I will tell you this surgery can be done very safely, very effectively, very practically with twilight deep sedation. Not a single patient to date has had any recollection of the surgery. Do you remember anything? Do you remember anything from the surgery? Do you remember going to sleep?
I remember, hurry up and get me to sleep. That's all I remember because I was very nervous.
Okay. Now, let me ask you this. You had implants for 15 years. What led you to an explant?
I have scoliosis, and I thought that the implants would help correct because my right side had a very big indent. But within 3 months of having the implants, I went straight into menopause super fast. And then I started having symptoms. I couldn't breathe because the implant was pushing on my one lung, hair falling out, all these dizziness, vertigo, just things that the doctors couldn't, sores in my mouth, all these different symptoms, atrial arrhythmia, heart palpitations, which I haven't had since my surgery. I haven't had one arrhythmia.
We just did a Facebook Live with a nice lady from the United Kingdom, and she said the same thing. It's been since 2023, she's not had a single palpitation, and we will see it's not only the 23 days, we will see hopefully in the future you'll not continue to not have them as well.
I think it affects the vagus nerve, the pressure, and I also, the hormones in your body, and that has a big effect too, I think, on your nerve rhythm.
So one of the cardiologists who referred a patient said it causes inflammation, vasculitis, inflammation of the around the nerves. That's the tingling.
Yes, I have.
And again, yeah. And so this, as a result, alters or affects the heart rhythm. As a result, leads to palpitations, irregular heartbeats, because there are many young patients and old who've walked into the emergency room with these irregular heartbeats only to work up with a Holter monitor, an echo, and a clean bill of health. And only when they have explanted has their palpitation complaint literally disappeared. And so there is a direct correlation. What else have you, so these were the symptoms that you were going through. What led you to believe that these were the implants?
Because the doctors couldn't figure out what was going on, and I have a background in holistic medicine, so I did my research, and I was finding more and more women with the same complaints. And then I found your page, and I started reading up on a lot of it, and it all made sense to me. And I just have really good intuition, and it just, once you know, it like really registered, and it was like, that's it. I just knew. I didn't doubt it after that.
Did you seek any other consultation other than
I
me?
did go to my family doctor because I was concerned about, am I going to be able to afford this on my own, because my insurance wouldn't cover it. And he was going to send me just to a regular plastic surgeon that would take them out, but they would not remove it the way that you do, where they take the whole capsule. My insurance would have covered the surgery if I would have followed their protocol, which was aspirating it first and then going through their steps, and then they would remove it, but they would not remove it with the capsule. And I knew because of my rupture that if anybody just removed that, they would have dumped all of that silicone into my body. And as we could see, when we removed my capsule and you opened it, it just dumped everywhere when you opened up that capsule.
Right, so very important. This is the take-home message. 6/25/25, the 25th of June. Please look at the Facebook Live, and you will see the Facebook Live when your right one was completely disintegrated. This was supposed to be the nicer, better, safer gummy bear, and it literally had melted in your right chest. And so the end block was the gold standard, and for it to be done in the fashion that it needed to, such that none of the silicone spilled into the chest, and you not had it, it would have spilled, and no matter how many drains or how much washout that I would have done, it would have still lingered on.
because it's just so gummy.
Right.
It's like glue.
What type of research did you do in order to kind of say, okay, I'm going to go ahead and get the explant and not a replacement? Because you could, had you gone to anyone else, they would have said, well, these are 15 years old. Let's go ahead and remove this old set and put a new one
Right.
in.
And I already knew that's not the case. I already knew because after watching your videos and then going to your website and then looking at other doctors, a lot of doctors still don't believe that implants have any effect on your body at all. And a lot of the other doctors were replacing them. And even I feel so bad for women that have cancer and then they go ahead and put these implants on. You just went through cancer and now you're adding something else into your body that's going to make you sicker. So it just didn't make sense to me. And my research mostly was done, and this was probably 2-3 years ago when I found you. And I followed you, but I didn't have the finances, and then I had some family hardships, and I had to put myself on the back burner. But this was the year I knew, hell or high water, it was coming out, because this was probably the sickest I've been this year, and I missed a lot of work this year due to illnesses.
Sure. Now, let me ask you this. Now, in 23 days, how much better are you?
Because 100%.
Really? Okay, so and I'll tell you, you're sharp. You're very, very alert. Before you were kind of ill appearing, if you will, just knowing your personality. Now that I've seen you like 4 times or so, you're literally down the street, 45 minutes away, so not too far. What would you say to someone who's listening to you and says that this is all in your head? This is like a placebo effect. This is just 23 days of just, this is something not real.
Do your research and listen to your body. I'm very attuned to my body, so any little thing, I know where it's coming from, and I pause and I'll sit and reflect and like, where's this coming from? But when I came out of surgery, it was the heaviness on my chest was gone. The ability to be able to breathe. And I had a lot of swelling, but I still was able to take a deep breath, even with this binder on.
No, you had a very challenging case. I remember the right side. I remember you vividly. And it was not easy, and I couldn't be happier. Even 20 years from now, I cannot imagine anyone else doing the surgery any differently. Now, let me ask you this. Did you need drains?
No drains at all.
Absolutely. I've not used drains in well over 5.5 years with the many, literally thousands of patients that I've done. Now, did you need a lift?
No, and that's what I was just telling Dr. Khan today. I remember before I ever had implants, I was completely flat. I was like AA. And I remember I would go like this with the extra skin or the tissue as you get older and say, oh, if this could only be pulled forward, I'd have breast. And I just mentioned when I came into Dr. Khan, I have more breast tissue than I ever had before having implants. It's like you pulled everything that was on my sides forward, and that's exactly what he did with the pseudo lift. And I didn't know that until he reinforced what I said, that, yeah, we do that. We pull this tissue forward. And I am beyond ecstatic because I have breast without implants, and I didn't even have that before implants.
Right, and you're natural, you're organic, and this is, the 𝐾𝐨 procedure. Like, I literally, with my first assist, doing the surgery, initially I used to do it on select patients. Now I do it exclusively on all patients. And it truly helps with the aesthetic contour, the lateral border, where the breast tissue contour is very much redefined once again now that the inflammation is gone. Now, the other thing I want to do here is I want to actually read your pathology report. And your pathology report says, quote, breast right implant, and I'm reading it, capsule excision, and it says, synovial-like metaplasia of the wall of the surrounding capsule with histiocytic infiltration and reaction to non-polarizable material consistent with silica. So silica was within your capsule, and had that capsule been left behind, you would have continued to hurt and you would not have bounced back in the manner as you are right now. Some patients say they have had no recovery if their capsule is left behind. And so this is a surgery where I tell all the patients, do it right, do it once, and do it with definitive certainty. You have to assume that all implants are ruptured because you don't want to find out, surprisingly, that it was. And this is where it is very well thoughtfully done, such that when we look back at it, we say that we did it, quote, perfectly right, close quotes. And so your pathology is very much consistent as such. Anything you want to tell anyone?
With your saying that, I was on your website and someone had said, what do I need before I come into surgery? And one of the things that I started to do starting last year was I did have a mammogram because that was the protocol I had to follow. And they did see that there was something going on, which led them to let me have a scan. And that showed that there was something, and that led them to let me be able to have an MRI, and the MRI showed a rupture. So I had mentioned that, I usually don't comment on your webpage, but I had commented that it's very helpful for Dr. Khan, if you do have those, to see that, because I could see if I was not going to Dr. Khan, and the doctor did not know I had a rupture, and he opened me up to remove that, they would just dump all that into your body. So it's kind of helpful if you do have those scans so that you know ahead of time that, oh yes, there is a rupture going on, because if it wasn't Dr. Khan and it was another doctor, they would have just not taken the precaution that you do taking the capsule out. Because the way that it was in my video, that just would have filled my whole chest cavity. And I do not see how you would have gotten that out.
Right, and it is impossible because once it spills, it's like slime, molten slime. It will basically spread all over the chest. Now, two things I want to mention. I always go into the surgeries thinking that the implant is ruptured till proven otherwise, because there are cases that I have done where the MRI showed no rupture, and lo and behold, to my total surprise, it was a rupture. So the MRI was wrong. One patient had a dictation that was done incorrectly. So it was transcribed by the doctor incorrectly, a human error. And so one cannot rely solely.
Right.
The only times I get an MRI or I mandate an MRI are both those cases that I did today, where the patient had an implant from 1976, and when they removed it in 99, it was ruptured, and now there was free-floating silicone, and the patient then had saline implants. So when I removed her saline implants today, I removed them along with the capsule, but I knew going in she had free-floating silicone, so there was a lot of masses and pockets of silica granuloma that I had to remove, in addition to the saline implant plus the capsule, and that residual silicone pockets that were bathing her tissue inferiorly at the bottom. And so now, number two, if you were to get the MRI, the insurances would never pay for it. And so this is covered by a cost, and I do not want the patients, because I'm still going to assume that they're ruptured. But this is obviously, according to the guidelines, if you look at the Mentor advertisement, they want an MRI at year 3, and then every 2 years they're onward. So if someone has had an MRI, an implant for 7 years, they should get an MRI at year 3, and then at year 5, and then at year 7. So 3 MRIs by the 7 years that the patients have had their implants, silicone implants. Saline implants, you do not need an MRI because they're like a water balloon. When they do rupture, they rupture completely. Now, thank you very much for sharing your journey. I'm very happy to see your progress. Do your homework, do your research. You sat on this for 2.5, 3 years, you were said. And I remember when you came to me, you were excited, you were ready to move and to buy your date and follow along. Initially, you might be overwhelmed because what's going on. No two surgeons are the same, but after some time, you will see there's only 10, 15 questions one can ask, and you will get all of these answered if you basically just follow me, even for a month, because these questions tend to repeat themselves. So in my practice, I'll end with this. 80% of the patients, now you're 64, you would think 64 with 350cc implant removed, you would need a lift. Neither on the right and neither on the left. And you've done very well. I have to give you a solid A+ for listening to my instructions and making my life easy. And you were truly compliant, and I cannot thank you enough for that. You've been truly wonderful from day one to work with as a patient, because I'll tell you, sometimes it's hard for me to work with someone who's been moving their arms or not being compliant because they have 5 kids at home, for example. And I don't blame them, but we want to respect the surgery, and we want to certainly respect the recovery as well. Well, thank you very much.
Thank you.
I appreciate it. Thank you very much for sharing your journey.